Hello, my name is Brittany Bennett, and I will be going over the swimmer's method. Patient preparation. Confirm patient's identity in 3 ways: wristband or paperwork, or ask the patient to state their name and date of birth. If female, confirm last menstrual cycle date. Confirm with the patient what we are imaging to confirm the order is correct before imaging the patient. Make sure to shield the patient with the appropriate lead shield. Make sure to remove all jewelry, metal to be taken off in the area of interest. Ask the patient to remove the undergarments in the area of interest as well. The IR size is 10 by 12. The IR orientation is portrait. The IR location is the wall bucky, or it could be on tabletop. The SID is 72 inches. Patient position is the patient will be erect or recumbent for this position, but patient's body will be in a lateral position. Part position, you will align the patient's mid-coronal plane to the midline of the table or wall bucky. Patient's arm closest to the IR will be lifted above the patient's head. The other arm will be down and slightly posterior to prevent superimposition. The CR location is perpendicular to the IR. You will direct the CR to the T1. T1 is found by palpating the vertebra prominence, or you could move 1 inch above the jugular notch. There is no CR angulation. And the collimated field is usually 1 to 2 inches past the skin, or you can do it up to the full size of the cassette. The visual of appropriate marker location, you will see that the marker can either be placed in front of the throat or behind the neck. KVP range for a real patient will be 90 KVP. And the instructions to the patient for the exposure, we will ask the patient to take a deep breath in, blow it all the way out, and then you will take another deep breath and hold it. Anatomy demonstrated will be C5 through T3 vertebra in the intervertebral disc spaces. The humeral head of the arm farthest away from the IR will be magnified. Superimposition of the cervical zygapophyseal joints, pillars, and posterior ribs will be seen. Items in profile, there are no items in profile. And then pathology best demonstrated or clinical indications. Usually we use the swimmer's method to see fractures or subluxation and pathology of the inferior cervical spine, superior cervical spine, and other soft tissue structures. This is also a good visual to see C7 and T1 if you can't locate it on a lateral cervical spine. As you can also see on the swimmers, the intervertebral foramen, zygapophyseal joints, vertebral body, vertebral prominence, right humeral head, left humeral head, vertebral disc space, C7, T1, and pedicles. And that's pretty much it. Thank you.